Welcome to this presentation on traveling with children with autism. Today we'll discuss proactive planning strategies that support sensory needs, preserve routine, and help caregivers navigate transitions calmly and confidently. Travel can disrupt routines, introduce sensory overload, and create unexpected transitions. When caregivers use structured preparation, children feel safer, less overwhelmed, and better able to engage in the travel experience. Some of the most common challenges autism-related travel triggers include loud noise, crowds, bright lights, unfamiliar smells or textures, long waits, and sudden changes in plans or environment. Travel can be used as a wellness support opportunity. With the right supports, travel can reduce anxiety, encourage coping skills, improve emotional regulation, strengthen caregiver-child teamwork, and create opportunities for independence in new environments. The travel pillars. Traveling with children is most successful when caregivers use intentional, sensory-aware planning. There are 4 core pillars that help guide travel experience in supportive and manageable ways: preparation, sensory support, structure and transition planning, and adjusting calmly. Pre-trip environment familiarization. Before leaving, caregivers can prepare children by showing destination photos or videos, previewing routes, practicing expected processes, and setting clear, positive expectations about the trip format. Here is an example of a calming travel social story. We are going on a trip, and it will be new and different, and that is okay. We can bring our comfort items, we can take breaks, and we are safe. There are different activities that can also be found on Amazon, like my travel and activity journal for affordable prices, and printouts available online, like the road trip social story. Creating a caregiver and child checklist should include the travel date and duration, destination preview materials, packed sensory supports, a visual schedule, and a caregiver-child communication plan. And during packing, some of the sensory must-haves can be noise-reducing or Bluetooth headphones, fidget or stim toys, a small weighted lap pad or plush, sunglasses or hats to help with light sensitivity, and a familiar comfort object like a blanket. Routine preservation tools. Packing familiar meals, snacks, hygiene products, and preserving sleep and medication timing helps reduce emotional and sensory disruption for children with autism while away from home. And including a travel-specific hygiene kit. A child-preferred hygiene kit may include their usual body wash, lotion, shampoo, toothpaste, and toothbrush for maintaining familiar scent and texture. Disposable wipes can also support quick sensory resets when needed. Structured scheduling framework. A structured travel day often works best when broken into transition blocks, like pack, travel, arrival, sensory reset, food, activity, reset, and rest. These predictable steps help reduce overwhelm. When communication during travel, concrete choice-based phrases work best, such as headphones or fidget, or break or continue playing. These options narrow emotional uncertainty and offer regulation support instead of vague questions. Managing waiting and transitions. Using visual timers make waiting feel predictable and less stressful. Giving the child a small responsibility like carrying a boarding pass or comfort bag can also support smoother transitions. For children who experience a risk of elopement, preventative planning is critical. Caregivers should choose rooms that are not close to exits, avoid balconies or outdoor access when possible, and implement a caregiver proximity plan inside the room itself. Additional safety steps may include ID bracelets, communication cards in the child's bag, door alarms if appropriate and allowed by lodging, and reinforcing regulation-based practices instead of reflective chasing. Safety doesn't mean restriction, it means preparation. When the environment is structured and the senses are supported, elopement risk decreases because emotional overwhelm and unpredictability are reduced. The AAC Community Resource Guide is designed to make life easier for families. It brings together local therapists, sensory-friendly activities, parent support resources, emergency contacts, and community programs all in one accessible place. It helps caregivers quickly find the tools, services, and supports they need without having to search on their own. Traveling with children with autism is not about having a perfect trip. It's about having a supportive one. Every journey teaches us something valuable about our child's sensory needs, our planning style, and our ability to adapt as caregivers. As you reflect on your recent or upcoming trips, consider what strategies help your child stay most regulated during transitions, how adjusting your sensory or scheduling plan impacted their behavior, what part of the trip felt most overwhelming, and what independent skill they practiced along the way. These questions aren't just observations, they are opportunities. Opportunities to prepare sooner, accommodate consistently, intervene earlier, and respond with calm flexibility when the unexpected happens. Take a moment to think intentionally about your child's needs and your own boundaries. The goal is not doing more, it's doing what works earlier, clearer, and kinder so travel becomes an experience, safe, confidence, and growth. Because when caregivers plan for regulation, children travel with less overwhelm, more understanding, and more mastery over transitions, one step at a time. Let's summarize. Travel success isn't about doing everything. It's about preparing proactively. Preview environments, pack sensory accommodation and routine anchors, break travel into manageable segments, make transitions visible, and adjust calmly when the environment changes. Be on the lookout for upcoming caregiver workshop events at Atlanta Autism Center by following us on our social medias listed on the next page. We'd love to hear your feedback on this presentation. Scan the QR code to access a short survey that helps us improve resources for caregivers and children. Every voice helps strengthen our caregiver support community, and I appreciate you for watching this presentation and being here with us today. Thank you.